on the Omicron variant, let's bring in Dr. Janette Nesheiwat, Fox News medical contributor and a family and emergency medicine doctor. Dr. Nesheiwat, thank you so much for joining us here. This is clearly something that lawmakers are concerned about, that public health officials are very concerned about, countries concerned about. We've restricted travel, as have a number of the nations in the United Kingdom. So how concerned should Americans be as we head into this holiday season?
So this new variant, the Omicron variant, it is a variant of concern, but we shouldn't panic. It's just important to be aware of what this variant could potentially do to Americans, to those who are vaccinated and to those who are unvaccinated. What we know so far is that there are a lot of mutations in this Omicron variant, and the combination of these mutations might make it easier for the virus to gain access into our cells, into our body, and make us sick. But the question is it more virulent? Meaning, is it more harmful, or is it simply going to be just more contagious? When we saw this outbreak in South Africa, we saw an increase in the number of COVID cases, but we did not see an increase in the number of deaths and hospitalizations. So that is reassuring. But right now, what's important is that scientists are trying to determine if our current vaccines are still effective, which I think they will be, maybe to a lesser degree, and also our current treatment modalities. For example, our monoclonal antibodies, will they still work? So these are things that we need to determine, and also to determine if someone has had previous infection and they have that natural immunity, those natural antibodies, are they at higher risk for reinfection? These are all the things that we are currently investigating.
What should we be seeing from the vaccine makers themselves when they're keeping an eye on this as well, keeping an eye on these mutations, working to combat it? Are we seeing success in those efforts being done by these major suppliers?
I believe so. Novavax, Pfizer, Moderna. Moderna, for example, has anticipated and was being proactive and knew that we were likely going to see more variants emerge. And they are already in the process of testing boosters specifically for Omicron. And also Pfizer is currently testing to see how effective our current vaccines are against this variant. I do believe they will still be effective. And I do believe the best way to protect ourselves are to get vaccinated, get your booster if you're eligible for a booster. If you haven't had any of the shots, it's still not too late to do that, in addition to getting your flu shot as well.
So I want to jump right into that real quick again, because I thought that was an interesting point you made about having boosters that perhaps will be specific to certain variants. Is that something we may see in the coming years?
Yes, absolutely. Just like we modify our influenza vaccines on a yearly basis, we need to be prepared to modify and tweak our mRNA vaccines. And that's the beauty of these vaccines, that they can be modified and adjusted accordingly for the new variants that we see emerging. And it only takes weeks, maybe 2 or 3 months, for these new updated vaccines to be available to us.
We're seeing these variants pop up in other places around the globe first. They seem to be monitored, and then we start looking for them here to find out if they're in America already and try to keep track. We saw that with the Delta variant. Very likely that we're going to see it again. How important is it that the United States, other wealthy countries, reach out to other nations that may not have the supply of vaccine, of boosters, and to make that happen? Will that help to prevent mutations and the global spread of the coronavirus?
Absolutely. Data sharing and transparency is critical. It can help minimize the spread and the transmission to other people, to other countries, just as we saw the Delta variant spread in India, to the UK, to the United States. But you're absolutely right, Molly. One of the most important things is we really need to ramp up our efforts on global vaccination. We need to make sure that, for example, South Africa, Africa itself, there's 1 billion people in Africa, and only 93 million vaccines were sent to them from the United States. So we're only as healthy and as strong as our weakest country. So it's important that we ensure vaccine equity and accessibility throughout all nations and globally.
You know, we have a supply chain crisis. We've been talking about it a lot. It's been a big hit to the economy. But to get things from place to place, that takes human beings, which means, does that contribute to the spread? And is there some way to kind of address it within the supply chain to get products moving again, as well as prevent the spread of the coronavirus?
Yeah, absolutely. The economic slowdown, the lack of workers, the lack of supplies definitely plays a role, because we need multiple ingredients to manufacture these vaccines. The ingredients, the needles, the syringes, the manpower. So it's a combination of all of these factors that are important, that we can get everyone who needs to be vaccinated, which is everyone over the age of 5, since Pfizer is now allowed for vaccine over the age of 5. That's millions of people throughout the nation and globally as well that could potentially be eligible. But it's just a matter of quick manufacturing and working on ramping up manufacturing hubs throughout the world so that we can prevent further variants from emerging.
Yeah. Dr. Janette Nesheiwat, thank you so much for joining us. Appreciate it.
Thank you, Molly. My pleasure. Thank you.